have all of our panelists here. So, good evening, everyone, and welcome to our first Pride Ortho Pride Month event, our Allyship webinar. Thank you all for joining us. I don't think anyone is new here to Pride Ortho, but we especially want to welcome any new members. And if you have attended Pride Ortho events before, thank you for continuing to be a part of this community. My name is Kayla, and I'll be co-hosting the webinar tonight along with Greg. He is having some Wi-Fi bandwidth issues, so he won't be showing his video, but he is here, and we'll introduce the panelists a little bit later. So I'm the Executive Director of Pride Ortho, and Greg is the co-chair of our Mentorship Committee. We're both proud allies and are excited to be here to learn from our incredible panelists of allies so we can all continue to grow together and support the community in orthopedics. So here's the plan for tonight's webinar. We'll start with a brief background of who we are and what we do. Then we'll transition to a brief presentation on allyship, specifically what does it mean to be an ally and why is allyship so important in the workplace and within orthopedics. Following that, we'll have our panelists introduce themselves and have the opportunity for audience questions. And we're really looking to have a fruitful discussion on how we can all continue to work together to fulfill our mission of making sure that everyone is welcome in orthopedics. And then finally, we'll wrap up with a brief discussion of more ways for everyone to get involved with Pride Ortho. So Pride Ortho is a community of proactive LGBTQ+ individuals and their allies with a mission to provide mentorship, networking, and a sense of belonging for members of our orthopedic community. We want to stress that everyone is welcome in the Pride Ortho community, and we're really excited to continue to expand our membership to more affiliate members, including engineers such as myself, researchers, industry professionals, and other affiliate careers in orthopedics, in addition to orthopedic surgeons. So we want to work together to make sure that everyone is welcome. So I will now share a brief video showcasing our community. This video was just produced recently, so we're very excited to share.
Orthopedics is, obviously a competitive specialty, and then, there's not very many females, and you go one step further into like queer community, and that's even a smaller group. And so it's definitely hard to find mentorship and just be able to connect and kind of get guidance and feel not so much as an outsider.
I think Pride Ortho is important to me because being able to join an organization of, like-minded people who identify as myself, allows me to feel like I can, really be my true authentic self while also being able to grow personally and professionally along the way.
For me, been a really important sense of not only community, but also inspiration and purpose that builds upon my foundation of interest in orthopedics.
I'm someone who's very out, and for me, that was finding a community of people who had the same interests as me, which in this case is orthopedics.
It's really an uplifting feeling knowing that, okay, like I belong here. This is where, this is where I'm supposed to be. I have a great support system. I have people I can reach out to that are going to, advocate for me.
I think Pride Ortho is very important because it's all about inclusivity. It is an organization that welcomes all.
I think it's really important for patients or just the community writ large to be able to know that the orthopedic community is welcoming and accepting of all individuals, and that they're going to be able to take care of anyone no matter what their identity is.
The LGBTQIA+ community is quite a diverse and heterogeneous group of people. And I think it's okay that Pride Ortho can mean different things to different people. And some people come in and want community, they want a sense of being together. Other people come in more interested in research. Some people come in because they're curious about mentorship or education or being a mentor to someone else.
At the end of the day, we're just one big group of diverse, fun, loving, bright-minded people who not only want to advance the field of orthopedics, but just make it the slightest bit more diverse and representative of today's population.
This is a hard time for people that don't fit the mold. And so the more support you give provides an environment where others might want to join.
We're really thankful to our corporate partners that have supported us as a beginning organization. Really, our source of sponsorship and support right now more than ever is going to be through donations. So we really need the support from donors such as yourselves.
Others should support Pride Ortho because, number one, it is the most fun organization to be a part of. We all have some aspect of us that is just a little bit different, yet we truly are one family.
Darkness cannot drive out darkness, only light can do that. And, hateness cannot drive out hate, only love can do that. And I think at the end of the day, that's really what Pride Ortho really stands for. We love one another. We're all here for each other. We owe it to ourselves, but more importantly, we really just owe it to our patients.
Help us support diversity in orthopedics. Please give to Pride Ortho today.
All right, so as the video highlighted, our goal really is community building, and we do that in several different ways. So first, we want to provide our community with a sense of belonging through our educational initiatives. So our education chair is on the call tonight. We have our Pride Ortho medical student initiatives, or our POMSI programs, that are half-day outreach programs for all medical students interested in orthopedics. They're hands-on activities and a time for Q&A and networking with surgeons from our community. There's these webinar series covering different topics that are important to our membership. We just reached out to we had many different fourth-year medical students that we were able to support this year with their away rotations. We're supporting 14 students. We also supported 8 medical students this year that attended AAOS. So in addition to our education initiatives, we also support research through our annual research symposium and newsletter highlights of our research conducted by members of our community. We provide mentorship opportunities through our one-to-one mentor match program, our CV and personal statement reviews, and new this year that we'll talk about a little bit later is our mock interview practices for residency, fellowship, and attending positions. Our communications team works to highlight the incredible work of our members, provides a safe space through an online forum for members to ask questions, and keeps the community up to date on upcoming events. And we work to set up networking opportunities for our community as well. This year, we had a really great turnout at our social events and business meetings at AAOS, and we're working to continue and establish and maintain the relationships with our fellow ortho interest groups, as well as our industry partners, and grow membership in the greater orthopedic community. We also, again, want to highlight our community resources, such as our friendly residency and fellowship program lists. So building off of that, now we want to get started with our allyship and ortho section of the webinar. So starting with the definition of allyship. And I know this changes for different folks, so definitely panelists, this is something to think about. How would you define allyship yourself? But the definition that I came up with is allyship is the active and consistent practice of supporting and advocating for the rights, dignity, and inclusion of LGBTQ+ individuals. And I think it's really important to note that the key word here in that definition is allyship is a practice. It's not just a label that someone can wear. To be an ally calls for ongoing actions and work to continue to support the LGBTQ+ community, not just during Pride Month, but really year-round. So some of these ongoing actions involve listening. So allies need to actively listen to the voices of the LGBTQ+ community and their experiences without centering their own perspective in the conversation. and learn from what is being shared. Learning. So in addition to learning from the community's voices, allies have the responsibility to educate themselves and others, when appropriate, about the LGBTQ+ issues, terminology, and history. So as a researcher, I know it's really important to start with finding reputable resources, such as those that we have shared on the Pride Ortho website under our resources page. So those could include organizations such as the Human Rights Campaign, Medical Student Pride Alliance, and the Trevor Project. It's important to amplify voices, so allies need to use our privilege to amplify LGBTQ+ voices and support efforts that promote equity and justice. We can't just be passive. We need to use our voice and platform to promote the voices of others, and especially those who don't have the same privilege and platform. And finally, advocating. Not only should we amplify LGBTQ voices, but allies should actively challenge the dissenting voices by challenging discrimination, calling out homophobia, transphobia, and other forms of bias. So ultimately, I view allies as people who engage in these actions with the larger goal of creating inclusive environments. Environments include the workplace or clinic, our schools, or the communities that we live in, and make sure that those environments are places where LGBTQ people feel safe and respected. So one such environment that I wanted to attest to tonight, where it's really important to have inclusivity, is in the workplace. Allyship in the workplace has been proven to improve employee mental health and well-being, as well as retention and performance in the workplace. So studies have shown that LGBTQ+ employees experience lower stress, anxiety, and depression when they feel supported by allies, and allyship contributes to a sense of belonging, which is really vital. This plot that I have here on the slide shows the results from a self-reported study done in 2022, where they had 31,000 respondents. And there is a clear relationship here showing that people believe that allies improve their sense of inclusion. It is also well documented in terms of retention and performance in the workplace that support from managers or supervisors leads to higher job satisfaction and better retention and performance. But when you also add in coworker support, in addition to the support from supervisors, that improves overall well-being in terms of both satisfaction in the job and outside of the workplace as well. Allyship can also ignite a culture shift within companies, clinics, or hospitals, and improve outcomes for your organization, as you can see here with these plots. As the proportion of employees who are allies increased, the emotional well-being of employees improved. And as the proportion of employees who attended ally training increased, so did the overall employee emotional well-being. So what can companies, clinics, or hospitals, or your organization do to promote allyship? Some potential ways to promote allyship in the workplace could include investing in diversity training and structured ally networks, promoting visible, authentic allyship year-round, especially from senior leaders, tracking inclusion outcomes, such as retention rate and employee surveys, like the one done here, prioritize intersectionality, so supporting individuals with overlapping marginalized identities, and measure and communicate the business impact, safety, and belonging to reduced turnover and improved performance. So allyship is not just a moral imperative, but it's also a strategic advantage in the workplace. It's critical to well-being, retention, and performance for LGBTQ employees. So those are some general workplace answers, but why is allyship so critical in the field of orthopedics? So I want to talk both about why it's critical in the training process for the healthcare professionals, but also why it's critical in terms of patient care. So first, let's talk about the training process. In ortho, as well as any occupation, or especially healthcare specialties, we really want the best minds, as we need the smartest people to solve the challenging problems that we face on a day-to-day basis. But if trainees don't feel welcomed in the community, we lose out on the talent pipeline. So this is a plot from a 2023 study that reported, and so in this plot, just to orient you first, the blue bar represents LGBTQ plus trainees, and the orange is non-LGBTQ plus trainees. And the percentages are the percent of respondents that said that orthopedic surgery is less welcoming. So they were asked the question, is orthopedic surgery less welcoming? And they said yes. So it's the percentage of individuals that said yes. So I show this plot tonight not necessarily to compare ortho to the other surgical specialties, but to compare this to this second graph. So this plot shows the percentage of trainees that considered or have chosen ortho. So again, the answer was yes, this time to the question, did you consider or choose ortho as your specialty? As you can see in this plot, it showed a high percentage of LGBTQ medical students believe that ortho surgery is less welcoming. And in the secondary plot, a lower percentage of LGBTQ plus identifying medical students considered or chose to pursue ortho as their medical specialty. So orthopedics is really still losing out on the talent pipeline, as brilliant LGBTQ plus students are still hesitant to join an unwelcoming community. We really need allies to stand with the community now more than ever, so that we can continue to recruit the best talent to solve some of medicine's most difficult problems. In addition to building the talent pipeline in ortho healthcare professions, allyship is also essential for patient care. One of the actions that I talked about in terms of allyship was education. So this is in learning. So this is a survey conducted in 2022 of 123 orthopedic healthcare professionals at 2 different academic hospitals. And it shows varying degrees of confidence and knowledge regarding the needs of LGBTQ youth patients. So as you can see, an overwhelming 99% of respondents felt comfortable treating children that identified as members of the LGBTQ community. But that percentage dropped drastically in terms of the healthcare professionals who were comfortable treating or knowledgeable in terms of what the needs were for those patients. So this really supports the needs for allies and further investment in education and training for orthopedic professionals to explore their own personal biases and implement changes into their own practices with the goal of providing equitable and informed orthopedic care. So with that, I will transition over to Greg, who will introduce our panelists who can share their views on allyship and how they practice allyship.
Thank you, Kayla. I think just to make this expedient, how about we each take 15 to 30 seconds just to introduce yourselves and who you are, where you're from. Start with Lisa.
Hello, thank you for having this. I'm honored to be a panelist. I'm Lisa Cannada. I'm an orthopedic trauma surgeon, and I have been a member of Pride Ortho since they started.
Bill.
Hi, Bill Levine. I'm from Columbia in New York City, and have been a member of Pride for, I think, 2 years now, and happy to be part of the panel tonight. Thank you.
Rina.
Rina Jain. I am a total joint surgeon here in San Diego, California, far away from LA. So we're all good here. And I've been a member of Pride Ortho, I think, almost since the beginning when Jamie Bellamy told me all about this.
Thanks for being part of the panel. Matt.
I'm Matt Salzler. I'm an orthopedic sports medicine specialist at Tufts Medical Center in Boston. Been a member of Pride Ortho for a few years. I don't actually remember exactly when I started, but it's been at least a few years, and thanks for having me here.
And Kevin.
Hi, I'm Kevin Bozic, and I'm the Chair of Surgery and Perioperative Care at Dell Medical School at UT Austin. Appreciate the opportunity to be involved tonight and also to be a proud member of Pride Ortho.
And I guess just introduce myself, Greg Brown. I'm actually doing general orthopedics at a 25-bed critical access hospital in Williston, North Dakota. So let's do these questions as a discussion in terms of, I don't know, do we want to discuss orthopedics or should we go right to allyship?
Allyship.
I agree. You jumped in first, Bill. Why did you engage in allyship?
Well, I didn't know I was really engaging in allyship because it didn't exist as a word until 2021. So, sponsorship and mentorship are what I've been doing my whole career and very important to me. So allyship, I think, is just a natural offshoot of that. And I think, as Kayla highlighted in her definitions in her remarks, whether you want to be a mentor or be a sponsor or be an ally doesn't, I think the words are less important than the actions of how you interact with people. Because a mentor who doesn't follow through, or a sponsor who doesn't follow through, or an ally who doesn't follow through are all in the same exact bucket. And vice versa, as I tell people all the time, it's a bi-directional relationship. So for the mentees and for the sponsees and the whatever the word is for allies, they have to, it is totally bi-directional. And yes, you need allies and you need sponsors, and you need mentors, but you need the people that are being allied, sponsored, and mentored to really be engaged, to follow through on timelines and on commitments, and really encourage the people who want to be allies to help see the trajectory of your career or whatever your goals and objectives are.
Exactly. Dr. Levine, you bring up really, really great points. I learned a lesson from my parents at a very early age that you come into a position of power or privilege or whatever, use that to help others. Any group, any demographic, any characteristic can become marginalized. We've seen that happen over and over through whatever centuries of human civilization. And for whatever group that there is, we just want to be there to help, to use. If I happen to be in a position of privilege and power, then I would love to be able to continue using that, right through mentorship. It's all well and good. I know I have various different people that say, oh, this is a terrible thing that's happening to the LGBTQ community. It's like, okay, thank you for acknowledging that. What are you going to do about it? And I get a lot of pushback from people who say, well, there's nothing really I can do, but it's like, there are always opportunities, and if you feel strongly enough, just get out there and do it. And like you, Dr. Levine, I didn't think of allyship sort of that, oh, I'm an ally, I'm just out here doing my thing. I'm trying to mentor, sponsor, just to prove that we're welcoming. And that's not only just for the LGBTQ community, but for anyone who feels that they've been marginalized. I mean, at the end of the day, we want everyone to fulfill their full potentials. And that's why I try to impart that on the students, that they are who they are and we love them for it. And they will become fantastic orthopedic surgeons, because somebody's got to do my total hip in 20 years and I need the best.
Let me add a word to the discussion. Coaching. So we talked about mentoring. I trained as a coach for surgeons, and the different, theoretically, the difference is mentors give advice where coaches ask questions and pull the answers out of the coachee. And so, but you can mentor as a coach. It's not a hard line. So what about coaching? What do you think that role is in allyship? Crickets.
Well, I'm letting Matt and Kevin go next.
I'll jump
Or
in.
Lisa.
I'll jump in. Thanks for the question, Greg. As someone who has worked with a coach myself for 17 years, the question resonates with me. I think that what I've learned about being an ally is that, again, like Bill, it's not something I was familiar with. I actually learned this term when I was president of the AAOS and addressing Pride Ortho at the AAOS annual meeting. And I've learned that it means using our own positions of privilege and influence to listen and advocate in support of our colleagues and our patients who are from marginalized or less represented groups. And as Kayla said in the beginning, I don't think this is a label we can give ourselves. I can't say I'm an ally. It's an active role. It's not a passive role. So it's something that means we have to show up every day and be humble and vulnerable and put ourselves in a position to advocate even when it's inconvenient or uncomfortable. And it's not enough to just not discriminate. It means we have to confront systems and structures around us that lead to the marginalization of certain communities.
I think one of the things that comes up, we're mentioning allyship, coaching, mentorship. Really, what I look at it as, and I know it's a little grade school term, actions speak louder than words. And that's what I believe all of this encompasses. Years ago, I started orthopedics in the 1990s. So that was when, women were less than 2%, 1% of orthopedic surgeons. And having experienced firsthand in the early years how isolation and lack of representation, which was very true then, can impact career trajectories, I truly understand the importance of making sure that my actions and anything I can do create a supportive community. Our specialty in orthopedics, no matter whether we're trauma surgeons, sports surgeons, or total joint surgeons, it's strongest when all of us embrace the full spectrum of human diversity and we ensure every talented surgeon, and that's every single person, feels valued and feels supported in what they are doing. So that's where I truly believe my actions speak louder than anything I can say.
So go back, I think it was 3 years ago. Was that when the Academy was in Chicago? Where the Ruth Jackson meeting, the keynote speaker made the statement that it is not a minority group's role to educate the majority. So how did you individually learn to work with these other communities? What did you do? How did you do it? I'll put you on the spot, Matt. I haven't heard from you yet.
Yeah, I think, to be honest, I agree with Dr. Levine. I'm still learning how to do this. I learned a lot from Ashley Rogerson and from a few of our residents. And, one of my thoughts, which is actually sort of peripheral to that question, is how easy or hard is it to be an ally? And I asked, when I was asked to do this, I actually thought it's in Boston, it's actually not that hard. I live in a very welcoming community that I think, right? I mean, I know not everybody feels that way. And, but to be an ally in Boston, at least, is not hard. It's hard to be LGBTQ in certain areas, especially in orthopedics, but it's not hard to be an ally. It is, I think, harder in other parts of the US and other parts of the world. And so I think that my job is actually pretty easy. If I'm mentoring anyone, whether they're LGBTQ or not, that's something that's important to me. But to actually do it here in Boston, I think is fairly easy. It's not really a question you asked, but that's what I've been thinking about for these last couple minutes.
Yep. All good input.
And the reality is this is a numbers game. And I'm sure we've all talked or heard the term representation matters. And, the very sad reality is that we don't have a lot of LGBTQ orthopedic surgeons, as Kayla's graph showed. It's that a lot of trainees already think that it's not a welcoming community. And our demographic in orthopedics, we have very few LGBTQ plus surgeons. We have very few women, and that's for another whole topic as it is. So that's why it is even more important for the allies to be really, really out there, to be very loud and proactive, for us to be extremely deliberate about that. We want to make it a welcoming community, that this is the change, that, we really truly represent the change in the world that we want to see, and try to mold orthopedics into our own vision. I mean, wouldn't it be wonderful one day if we didn't need to have all of our wonderful groups like Ruth Jackson Orthopedic Society, or for ACUS, the Women in Arthroplasty group, because we are all feeling so welcomed, and that we have adequate numbers and representation. That, I mean, at the end of the day, we're all just orthopedic surgeons. We love doing our thing here, but that's why it's important for the allies to be out there. We just don't have enough numbers of the LGBTQ community yet in orthopedics.
Well, that's
Greg, I'll
Oh,
just
go
add
ahead,
to
Bill.
that, to your question about what can we actively do. And I think as leaders, we have the responsibility to create a culture where everyone feels seen and heard and valued and not just tolerated. And culture starts at the top. And so we have the responsibility and the privilege to create that type of welcoming and inclusive culture in our specialty.
I think it's important when anyone has any leadership roles to advocate not only by creating the culture, but also developing, put our actions into words. Again, I'm using that term, and I believe it's so important, where we advocate for inclusive policies and practices in the organizations we're a part of. It's great that we all have our own silos. And if we advocate for, that we're developing policies and practices that one, organization can use and copy, and we can grow that way. And also, I think the mentoring, we talk about the mentoring, and we have a mentoring committee with Pride Ortho, to make sure that everyone of all backgrounds has the ability to be mentored. And for that, we also need to use our roles to make sure we're culturally competent and aware, because that's another thing we can do as leaders, not only for policies and practices. We want to create cultural competence and awareness, and ensure that our education materials, having this webinar is great, and making sure that there's other webinars like this, and having other professional development resources to be inclusive and welcoming to all, no matter what you do, whatever wake of life you're from, and whatever career stage you're in. Because there might be some people who were quiet for a long time, but are more advanced in their career and also need this allyship.
Well said.
Hey, Greg, can I kind of give a slightly provocative perspective?
Absolutely.
Because that's what I like to do.
That's always needed.
Well, so there's a couple of issues, and we're talking about some important issues on this topic, of course. But one of the things that's really important for people to appreciate, if you're a medical student, and whether you're female, Black, Hispanic, LGBTQ plus, white male, white female, it doesn't matter who you are, orthopedic surgery is hard. Orthopedic surgery residency training is hard. Being an orthopedic surgeon is hard. Being in practice is hard. It doesn't get easier. In many ways, it gets harder. And so, of course, you want what Dr. Bozic has just said, and what you all are saying is we need to have, hopefully, cultures and communities that are welcoming during that hard training process. But I think that whether you're in a minority group or in a majority group, don't look at the content and makeup of the residency training program as the determination for whether or not you will be included or not. Because if you're not in the majority yet, that's going to be pretty obvious. But really ask yourself why you want to be, back to the question we didn't cover, why do you want to be an orthopedic surgeon? And that question is often very cursorily answered by people that are thinking about orthopedics. So I would have, when I sit down with a future potential mentee, this is a very long conversation that we have about why do they want to be an orthopedic surgeon? What is it about orthopedic surgery? And whether they happen to be in a minority group or not, okay, well, we'll address that in whatever way we need to. But I think it's controversial, Greg and team, but I think you have to have that conversation because I think it's easy to sometimes say, well, I'm not going to orthopedics because they're not welcoming to my community. Okay, you can make that choice, but you can also say, hey, why not me? I love this. I really want to do it, and I want to help change the tide. And you can do that from inside. You can't do that from outside. So I'm just posing that as just a slightly different twist on a really complex and controversial topic.
I agree with you completely. I actually just spent the weekend in St. Louis with Nth Dimensions, and we were discussing emotional well-being. And everything you said resonates with me. And what I would tell you is I would say that slightly different as the toll of going through residency in orthopedics is huge. The second group of residents I worked with when I was faculty at University of Minnesota, 50% of them were divorced by the end of residency. 50%. It has a huge toll on your life, emotional well-being, and everything else. And so if you don't absolutely want to be an orthopedist, going into orthopedics to try and prove something to somebody else, it's not worth it. I can't imagine it being worth it. So I'm going to use this as a transition to why is being an ally important to you? And for me, I got into it because in end of 2017, I was totally burned out. I was fried. I almost left medicine. Instead, I started working part-time and tried to heal. And what I found was the mentoring and the coaching and working with others was very healing. And so you can argue that helping others was actually selfish because it helped me heal. But why is it important to others in this group, other panel members? Why did you get involved?
Well, I think it's a natural extension, as we were talking about earlier, of the mentorship, sponsorship that has just been in there. And then at least for me, I've gotten involved with American Association of Hip and Knee Surgeons, especially, and various other committees that we actually have the power to make changes. I've become more and more aware of issues and actually even more appalled at the hatred that is lobbied against, the LGBTQ community. It's like, okay, I need to stop just saying, oh, that's terrible, and actually get out there and do something. I mean, I think some of you know that I'm actually from Canada, and we've had LGBTQ rights in Canada for a much longer time than the US. So when I moved down here and I saw a lot of this hatred against the community, I thought, what? This is not what I grew up with. It's just not how things are done. So for me, at least, I just see an injustice, have to do something, at least, even if it's a small thing. I mean, I may not be able to save the world, and I can tell you countless stories of various students who have come through, and sometimes it's just the simplest little act of, sometimes when I sign my email, or actually all the time when I sign my email, I put down she/her. And a few of them said, you signal to me that you are welcoming. Other people, they don't even care, so that's fine. But it just means a lot that even if one person said, wow, thank you just for being there, it's like, yeah, you bet, I am there for you. And it's also a way of giving back. As you know, females in orthopedic surgery, we are so few. And the mentors I've had, there've been a few women. It's been a lot more male mentors, just because of the sheer numbers, who said, we're just doing it, we're supporting the best of the best. It's all about promoting good quality.
I think that's important by us being allies and also being vocal on and showing that we're members of Pride Ortho and that we support it. I remember after coming back from the Academy meeting and I had posted something about the Pride Ortho meeting that I was at, then someone in the Department of Medicine at the medical school asked, hey, tell us what you are doing and how do you create that environment? So I think that by being leaders and being vocal. I'm actively working, I'm to create not an inclusive environment, not only for all orthopedic surgeons, but anyone in medicine. Because if they see, a surgeon that's sticking up for it, then that can create it in other subspecialties. And I also recognize that LGBTQ surgeons may face barriers to full acceptance and advancement. So anytime I can include them and do something to help, whether it's taking the research committee, working with Ashley and trying to show the value of what we're doing. It really, allyship means being able to use my platform, whether it's in research, whether it's in mentoring or teaching, and use my voice to be an advocate for equity and belonging for everybody.
I wanted to build on that, Greg, and just say that, Kayla brought up in the beginning why this is important from an expediency standpoint. And just as a leader of a large organization, this is the way you build trust within the organization. And we know that diverse organizations outperform more homogeneous organizations on any metric that you can measure: financial, clinical, well-being, retention. It doesn't matter. So even if we're sort of looking past what's fair and just, which none of us are, as a leader of an organization, I want to have a culture that has mutual respect and trust so that we function more efficiently and achieve better results.
I think that similar to what we've been talking about, I think becoming an ally or being an ally, if you're in a position of leadership, is just I've said this many times. I think, and Kevin just said it earlier, that culture starts from the top. So if you have the leader of an organization that treats people poorly, makes fun of people, is insulting to people, then that becomes the accepted culture, and we see what the downfall of that can be. Conversely, if you have a culture where people are treated with respect and encouraged to just be themselves, whoever they happen to be, then that's fantastic. And then I think the real point and I think Rina was hinting at this, for me, when do you know that Pride Ortho has kind of hit their stride? When they can have a webinar on plantar fasciitis, when they can have a webinar on reverse shoulder replacement, when they can have a webinar on orthopedic issues. And when I was a board member of RJOS, as Lisa knows, I was a broken record. But I said, RJOS, exec committee, stop having webinars on women-only, female-only issues. Don't you have unbelievable experts in hip and knee and spine and trauma and all the things? And so they heard and they started to do that. And obviously there's larger numbers there. But the point is that the more you can start to say, hey, we're orthopedic surgeons, back to my plea to say, do you really love this? And not be seen as a one issue organization. I think that helps. I think that helps show the world that you are, whether it's ASCS or Pride Ortho or AOSSM or AUKUS or whoever else, these are unbelievably talented orthopedic surgeons who have a lot to share. And that's not to say that you're going to not obviously have webinars like this. It's critically important. But I think the more you can start to branch out and show who you are is beyond just being LGBTQ plus or female or African American or whoever you are.
Any other comments on this one, or we can move to the next one?
I had two comments. One, going back to the initial question, is why is being an ally important to me? So I am an academic, as most of you are, because I wanted to be a lifelong learner. And this is one area where I'm still learning a lot from all of you. And that's one of the things. I think a lot of these mentor-mentee relationships very much are bi-directional. The other thing I was saying, tied into both Kevin and Kayla said. So Kevin, you talked about diverse organizations outperforming non-diverse organizations, and I do agree with that. But one of the things that Kayla showed is that we don't always feel comfortable taking care of the LGBT community. I don't know if there's data on this specifically, and if there is, I don't know it. But when you look at other underrepresented minorities as physicians are more likely to care for those underrepresented minorities as patients. I imagine there's probably some truth to that, even though we say 99% of us are comfortable taking care of LGBTQ patients, it doesn't mean that 99% of LGBTQ patients are going to be comfortable with us taking care of them. And so having more LGBTQ surgeons, I think, could actually help our patients out a lot. I think that's one of the reasons why that's important to me.
So my turn to be the disruptor here. So, I mean, is treating an ACL tear in someone in the LGBT community different than treating a white male with an ACL tear or a white female with an ACL tear? And so, to me, it's a funny question. To me, the question is more, are you comfortable interacting with someone that's not like you? Because we all have the same medical knowledge, and short of transgender women or men that have hormonal issues and may have some very specific different medical issues, most people in the LGBT community aren't going to have different medical issues. It's the interpersonal communication that's, I think, causing the discomfort, not the medical care. Am I missing something?
I think that you're right. I mean, I think that I'm not necessarily treating an ACL tear. I'm treating a patient with an ACL tear. And having a relationship with that patient, whether they're white, brown, or blue, understanding who they are and what they want and why they feel the way they do about everything is sort of critically important. And so, yeah, I do think that you're right. And I don't know that everybody is as comfortable as they think. I mean, sometimes things come up that you may not be comfortable with. I think the majority of us want to be, and here clearly, but I have heard things over the years, even in Boston, that makes me think that we're not as welcoming as not this group, but as a profession as we ought to be.
Man, I just think that's I think you're just giving an honest answer. And I think I understand Greg's response, but I think that I'm sure that there are people that, whether you have racist tendencies or anti-Semitic tendencies or homophobic tendencies, we're seeing that doesn't mean that doctors always act the way that they should. So God knows in the last 18 months, we have seen some pretty horrific things said by physicians about people and that they might have to take care of. So I think it's a very honest kind of heart emotional response that you're sharing. And I appreciate you sharing it.
And, you make a great point that, Greg, that, if I'm doing a total hip, it really doesn't matter who I'm actually doing it on the medical side of it, but it's more sort of the social aspect. Patients have to be taken care of by their family members. Will a lesbian woman on whom I'm doing a total hip, will she feel welcome in my office to bring her wife? Will she feel welcomed, or to have that wife wait in the waiting room that I can come out and talk to them? And so we have to make sure that we are very welcoming, or like I can be as welcoming, but will the rest of the staff, will the surgery center be like that? Will the hospital? I mean, luckily I'm in California, so the answer is yes, but they do bring up these concerns, how comfortable they are, or if they happen to bring somebody of the same sex, and say, oh, this is my friend, when in reality it's their spouse. To say, it's okay, you can tell me it's your wife, your husband, your spouse, whatever, or partner, however you want to say that and to feel truly welcome. I mean, I can be welcoming, but I don't know how much I can control for the rest of my staff. So it's very important to set that tone. Again, medical side, yes, we can take care of the social side. That's something we have to work on. And you're right, in the last 18 months, we've seen a lot of stuff, people saying a lot of really cruel and uncalled for things. And to be honest, we all have unconscious biases. I mean, I have to remember to check myself as much as, as open and stuff as I think I am. I have to remember, nope, check that unconscious bias, because I'm sure I have them, and I need to check myself before I start lecturing someone else or doing a sermon on someone else.
I think those are excuses. I think and that we don't want to be uncomfortable. And I think the biggest impediment is that the majority, the plurality, doesn't want to be uncomfortable. Anyway, I find that question just, the comfort need a little more in depth in a future research project, Alicia or Aaliyah. Anyway, the first time I went to Nth Dimensions, which for those of you who don't know, is primarily worked with Black underrepresented minority medical students that want to go into orthopedics or other competitive specialties. And I consciously, this was going to be the first time in my life where I was going to be a minority. And I was prepared to be uncomfortable because I've never been in that situation. The irony is that when I got there, it was one of the most welcoming groups I've ever been in. I never felt uncomfortable, but I intentionally had to overcome that discomfort. And I don't think most of it, we're working so hard, we're doing so many things, we don't want to be uncomfortable in these other contexts and other situations. Thoughts?
I think how comfortable we portray ourselves is gonna, as Dr. Jain was saying, it sets everyone in our clinic pays attention. It might be us that might be comfortable taking care of the LGBTQ patient, but what happens if our front office isn't welcoming? Or what happens if the person rooming isn't concerned with the terminology that's preferred? So I think it's very important that we lead by example, but we also educate as part of all of our work that we're doing. Because otherwise, it's not, we want to teach anyone, any surgeon to take care of everybody, but we also got to teach all of our staff and we got to make our patients feel welcoming. We got to realize why we do this. It's the patients, and we got to think of what we can do. Being allies doesn't just mean for our medical students, residents, and other surgeons. It means being an ally for our patients also, and ensuring that they feel welcome and inclusive in our environment.
Yep. Actually, I'll add one other family. One of my sons identifies in the LGBT community. And so when he sees me doing these things, it tells him he belongs in our family. So we are 3 minutes left. We better, we didn't get any questions. I'm sorry, we hogged all the time. Anybody have a burning question? I don't know that we need this. The remaining slides are ways to get involved with Pride Ortho if you haven't been involved. And I think everybody on this webinar is already involved and knows about Pride Ortho. So how about a question for someone? Anybody have a question that we can put in the chat? Oh, we've got a couple potential. Any questions, anybody?
I think I would still like to hear your all's thoughts on the last question that was listed there.
Sure.
Myself, as a young aspiring ally, I'd really like to know your all's what advice you would have for individuals such as myself, or others.
I hosted a speaker last week named Damon West, who's a best-selling author and spent 10 years in the federal penitentiary, and talks about how he got through there without affiliating with any of the gangs by race or religion or anything else. And his advice to us was to spend time with people that don't look or think like you every day. And that's made him a better person. And that's something that I've taken to heart and I'm trying to do more of myself.
I think that the best thing to do as an ally is, I think, when you are I say this all the time, as a residency director, you might be interested in diversity, but you ultimately don't get to hire your residents. You get to rank the students on a computer match list, and then hope. As a faculty, as a chair, as Dr. Bozic is, and others are, if you have that opportunity, you can make purposeful decisions on what diversity looks like. And not for diversity's sake, not for inclusivity's sake, because we know those are positive attributes, but because of merit. And I tell people this all the time, you know, you have to walk into a room, and if you don't look like the majority, people will be raising their eyebrows. They will be saying, Levine hired you because you're fill in the blank. And so you have an opportunity, not a burden, an opportunity to show them that Levine hired you because you're the best. And now let's roll your sleeves up and let's all figure out how to get you to that desired place. So that's for me how you teach about allyship is you take your position where you have opportunities and you use it for what you think is important for your organization.
Well, I think that was very well said, Bill. I want to thank all the panelists and everybody on the webinar for attending. I appreciate all our discussion and input. And I've got 8 o'clock, so unless anybody has any final comments, thank you all.
Thank
Thank you.
you.
Thanks.
Thank you.